Hello, my name is Brady Kerkman, Executive Director of Marketing and Business Development here at Windom Area Health, and I welcome you to today's episode of The Pulse. Today I have with me Jared Schmit. Jared, tell me a little bit about your role and your services you offer here at Windom Area Health.
I am the Outpatient Nursing Supervisor here at Windom Area Health, and what that means is that we have an outpatient center here for infusions, injections, things of that nature, dressing changes. So I coordinate with our scheduling department to make sure that all appointments are set up. Referrals coming from your primary care doctor or even a specialty doctor. Our scheduling office will reach out to you, schedule that appointment, and then you come in and see me for whatever it is that you need for your medical reasoning.
How long have we had those services here?
How long have we had those services here? We've had those for many number of years. I've only been here almost 2 years myself, but it goes back quite a ways.
Well, and tell me a little bit about what are the advantages of offering those services here rather than someone having to travel, to Sioux Falls or Rochester or Mankato, things like that?
Well, the biggest thing is time and resources. Obviously, if you're from the area, it's nice to come in, have a 5-minute drive maybe, or if you live in town, just a couple-minute drive and save time and save money. But the biggest thing too with the travel is in the winter months when the weather gets bad and you have appointments that or infusions or injections that you need to have, it's nice to just get it done here locally a lot quicker, saves time, and it keeps you safe from having to take those long travels to Sioux Falls or Mankato.
Well, and correct me if I'm wrong, but don't some people have to have those 2 or 3 times a week?
Yep. We got some people that come in twice a day, every day for a short amount of time. Some people that come in once a week or twice a week, that kind of thing. So it just helps with that frequency that you're just coming in locally to the hospital.
Absolutely. I can't even imagine if I would have to travel to one of those 3 locations, 2 or 3 times a week or every day. I mean, what a loss of time and resources. And as you said, we all know what the Minnesota weathers are like.
Correct. Obviously, last winter was pretty mild. We'll see what we have this winter, but it's just nice for that peace of mind to get it done here locally. And then to see the same person, I think that's the big thing. If you go out to Sioux Falls and have some of these things done, you're probably going to get a different nurse every time, and they're fully capable of doing that, but it's nice to have the same person every time giving you your medical, making sure those needs are met.
Well, I know I've heard a lot of individuals say that they really build that connection with you since they are seeing you every time.
Yeah.
Tell our listeners a little bit about infusions can mean a lot of different things to a lot of people. Tell us a little bit more about what that means. What is an infusion? When is it necessary?
Most of the infusions that we get, it could be like if your iron levels are low, you need an iron infusion. You come in, and that's usually just once a week for maybe a couple weeks. Some people might feel sick, especially as we head into the winter months, flu, that kind of thing. If you get a little dehydrated, a little bit behind on your fluids, you can come in. We're going to get you in a private room, which is pretty nice. Not all facilities offer that. Got to start an IV, that kind of thing, but give you a liter of fluids. Takes about an hour, depending on that. But other things that we do are antibiotic infusions for infections and things of that nature.
And if a person wanted to get a hold of you, how could they reach you, Jared?
The best way, typically, we end up reaching out to you once we see that the order is in from your primary care doctor or your specialty doctor. But you can always call the main line to the hospital and talk to registration. I do have a work cell phone. It's 507-407-3258 if there's any other issues that need to be resolved pre or post your visit.
Are patients able to call you on that line?
Yes, absolutely. Yep.
Okay. Well, again, it's important that we can provide those services. You hear me say regularly that we're constantly expanding what needs to be done here for our community. This is just another prime example of that, trying to remove some of those barriers and burdens. And, again, this is Jared Schmit with Windom Area Health. We thank you for tuning in today and watching. Jared, thank you so much for joining.
Thank you. Thanks for having me.